Hello, for Wall Street Media, this is Maria. I'm here with Doug, and we'll help you make money in the stock market with information you cannot get anywhere else.
Do you know something? It was so hard for me not to even interrupt the introduction.
You're so excited.
This was fantastic stuff. Ladies and gentlemen, this is why we do this show. We webcast 20,000 CEOs a year, and we don't always, I'd love to tell you we always did, but we don't always have breakthroughs like this,
no,
right?
This has been an amazing day.
How awesome is this guy? How awesome is this guy? We've got a video, you've got to watch it.
Absolutely. We have Clay Siegel, CEO of Seattle Genetics, their ticker is SGEN, and he discusses antibody drug conjugate, or ADC, the basis of their compound SGN-35, which completed phase 1 trials, resulting in 75% of Hodgkin's lymphoma patients reporting tumor regression. The company plans to report more data in June.
Now, the third of our major 3 programs is an ADC, or antibody drug conjugate. These are antibodies that are linked to potent payloads. And it's a very simple concept, and people have been looking at this concept for quite some time now. We believe that we've created a system that is ready for prime time, and we put this in clinic. The system we've developed uses a stable enzyme cleavable linker with a very strong half-life. The issues in the past with taking an antibody and empowering it have been there. They've been linker system. If your linker system is not stable, you inject an antibody drug conjugate into a patient, and the antibody and the drug fall apart right away. And that's been plaguing this field for a long time. We've developed a very stable linker that gets cleaved by enzymes inside of tumor cells. We have a cytotoxic drug called auristatin that is synthetic. Another issue has been using natural products. They're hard to make, they're expensive, cumbersome. We have a synthetic drug linker unit that's very inexpensive. You can attach it to almost any antibody. It's a low cost of goods because at the end of the day, the antibody is what costs a lot of money. And if you're using a drug conjugate, you're going to be using somewhere between 5 and 10 or even more times less of your protein. So the overall cost of the goods will be less with a drug conjugate. And we have a broad IP portfolio with our ADC technology. Now, SGN-35 is the first of these products that we've developed into clinical trials, but certainly this will not be our last, as we have many in our pipeline. SGN-35 targets CD30, and it's CD30, it's an antibody to CD30 linked to auristatin. It's an anti-mitotic agent, blocks mitosis. Now, we like CD30 as a target because it has very limited normal expression, but it is expressed strongly on tumors. Now, we have a phase 1 dose escalation trial in Hodgkin lymphoma and also T-cell lymphomas that's ongoing. We're looking at safety, PK, and anti-tumor activity. Now, we reported data at the beginning of this trial on 23 patients. We reported dose escalation from 0.1 to 1.8, so it was the early part of this study. These were heavily pretreated patients. More than 3/4 of them had prior stem cell transplant, many prior cycles of therapy. We found that SGN-35 was well tolerated, and we showed in our early data of this phase 1 study 4 objective responses, but 75% of patients had tumor regressions. We've gone much further now. We've treated a lot more patients in phase 1. We have pretty exciting data. We're going to show a lot of objective responses using this drug at ASCO in June. So we're going to be presenting at ASCO.
This is why we do this, okay? These guys are up 7.8% today. The whole market was up, let's be fair, right?
Yes.
As you were nice enough to point out to me.
Luckily,
Right? But let me tell you something. They're still near their 52-week low. And did you watch that? Now, you can click through. You can see the whole thing. It's free. wsw.com/webcast/in6, right? Watch the whole thing. Do we have slides for them? Do you know?
We do, I believe, yes.
Look at the slides. Listen to the whole thing. But, man, 75% tumor regression.
I know, and
this is
really
biotech of the future, and he's impressive, isn't he?
He is. I actually listened to the entire webcast, and it really was a wonderful presentation. And what I like is they're really looking into cancer help, but they're also looking at cutting costs. I mean, that's what he was talking about.
I know.
Making cancer drugs affordable.
Do you know something?
It's so important.
I saw one of the news magazines had that, Maria, and they were saying, it's such a shame because even for the people who recover.
Yeah.
They're bankrupted,
Oh,
because
not only that.
What do you do if it's your family member? What do you do if it's your family member and you say, like, oh, I need this and it's $75,000 a year and my insurance won't
Yes.
cover, right? You know,
Or not only that, a lot of doctors not even going there
Right.
because they think it's too expensive.
Just
you know,
too
so
much
it's
for you.
wonderful. That's
Man,
really exactly
awesome.
what
Guys,
we're looking for.
a biotech rock star, man. Biotech of the future is coming today. Listen to this. Watch this guy. See if this guy doesn't impress the heck out of you. Watch the whole presentation. She's the resident super genius here, right? And if she listened to the whole thing and said that this was impressive, we wouldn't mislead you. This is awesome stuff. I'm going to be adding a bunch of this stuff to my co-investor portfolio. You can follow it for free.
Exactly.
Right? And see that that's true. I put my money where my mouth is. We do 20,000 of these a day. I'm super excited, right? I'm bouncing in my chair like I'm caffeinated.
Hard
and
to keep them under
It's 7
control.
o'clock in the evening, okay? And as hyper as I am, I couldn't do this 20,000 times a year. This is a special one, and you ought to take a look at it.
Absolutely. And we're here every day at Wall Street Media. You can find us directly at WSMCO.com. Thanks for tuning in.